What would you advise a DSP if there's a situation where a person that they support comes down with COVID and they still are, they're still going to work to support that individual, or maybe they're the only person who is there to support that individual. We know of situations where that has happened, where a DSP has gone and lived with that individual for weeks at a time. What are some things that they should do to reduce the risk of their own infection?
Sure. So, one of the things that I would say is to start with the basics, the things that we've heard with hand hygiene, social distancing, that watching themselves for, any signs or symptoms of illness as well. And as Ruth had discussed, having that backup. But if you are providing direct care to somebody who has known COVID or suspected, you really should be wearing the full amount of PPE per CDC guidance. And that includes gown, gloves, an N95 or higher level respirator, and eye protection. And I know this isn't something traditionally that you've done in your roles. And I also want to be really mindful that each setting is different. And so, some of the people you serve, if you come into that environment wearing that full PPE, that might be really alarming to them. It might be very frightening to them. So, pre-planning that out and, making sure you have those supplies to really protect yourself, and, thinking of how are you going to acquire that supply? How are you going to educate yourself on using that PPE? And then maybe pre-educating some of the people you support, saying, hey, we do know that there's a lot of COVID in the community. If you get sick or I get sick, here's our plan. Here's what we're going to do, in a way that they can understand, so that it's not as fearful. And, I really would encourage DSPs to wear that full PPE. We are hearing of a lot of PPE fatigue, but really that's the way that they fully protect themselves. And so, especially when you're providing direct care, if you're doing any dressing or bathing or, that really high level hands-on care, if you're not wearing that full PPE, you increase your risk of acquiring COVID yourself.
Over the last year, we have done surveys with DSPs and asked them about protective equipment and what they've had available to them. And in some cases, they have quite a bit, and others they don't. So this is really a good reminder and a good piece of information for DSPs to take to their supervisors, the providers, to ask for these things to be available in the case that they do need them if someone gets infected.
Agree. I think that pre-planning is really important, and knowing how to use it and feeling comfortable, in that PPE and confident. And, earlier on in the pandemic, we did have a lot of supply challenges, and I can share that currently our team is not hearing of any supply chain shortages or challenges. So even if, you couldn't acquire certain, types of PPE previously, try again, or try with a different vendor or a different avenue.
Absolutely. And I really liked it when you reminded us that it may be frightening or overwhelming for someone to come toward you who has a lot of that equipment on. So what can you do to help people get prepared for that? And whether that's, trying those things on with them ahead of time so they know what it's going to be like if they have to use them, or watching videos to kind of desensitize a little bit from that overwhelming feeling.